Hello and welcome back to Community Connection. I'm Iowa City Mayor Bruce Teague. We're using this platform to showcase how our community is stepping up during a time of crisis as the coronavirus pandemic continues to impact the Iowa City area. Among those leading us through these uncertain times is the Johnson County Public Health Department. From tracking active cases to coordinating resources with medical providers, this department is among the most crucial links in the chain of command. Joining me to discuss the response to COVID-19 is Johnson County Public Health Director, Dave Koch. Thanks for joining me, Dave.
Thank you for having me, Mayor Teague. I really appreciate it.
Well, I'll tell you that how long have you been with Johnson County Public Health?
I started down here in 2012 as community health manager and then the director since 2017. So about 2.5 years in this role.
Okay, so is this your first kind of major emergency where the EOC is all activated and such?
Either good or bad, it's not. I have had experience with this before. In 2008, in the floods of Cedar Rapids and Iowa City, I was very involved in that in a previous role. And in 2009, I was with Linn County Public Health when we had the H1N1 outbreak. And then down here in 2015 with the mumps outbreak at the University of Iowa campus. So yeah, this is unique in a lot of different ways, actually, where the others were more specific to a state or a region or a country, where COVID-19 literally is affecting every single person, not only in our community here across the state, across the United States, but across the globe. So in that respect, it's very unique.
Yeah, this is a pandemic, as you say, it affects across the globe. And so, but your experience, of course, in the various areas that you just mentioned have kind of prepared you a little bit for this. What are some of the roles of Johnson County Public Health right now when it comes down to the positive cases? How are you notified, and what's the process from there?
Well, the part of the role of any local public health agency is obviously in preparation. So this is part of our responsibility as public health, especially local public health, is to prepare for these types of events. And so we work with all of our community partners, the emergency management, all of the hospitals, first responders, the nonprofit community, businesses. And so we periodically have drills that we will set out at the Emergency Operations Center, roughly 8 of us, and really work through different scenarios. But to go back to your other question, Bruce, with kind of how this process specifically works and our role here at Public Health in terms of the investigations. So let me just explain that process real quick. So if an individual has signs or symptoms, they are to call their healthcare provider, and then it's the healthcare provider's determination based off some criteria whether that individual would be asked to come in for a test. Once that individual is tested and it's positive, then that result gets reported from the laboratory, whether that's the state hygienic laboratory or a private laboratory, is reported to the Iowa Department of Public Health. And then once the state receives that information, they put it into a system. It's called the Iowa Disease Surveillance System. And that system is utilized by all 99 counties. And so this process is the same for every county in Iowa. But once that result gets put into the system, then our staff, our disease prevention specialists, will be notified of those positives. And then we make contact with those individuals. So what that looks like is we'll call them up and we go through about an hour on the phone with them, going through a form that we ask a lot of different questions. We also get all of those close contacts and then make contact with them. We talk about mitigation strategies. We talk about isolation, all of those things that are so critically important for individuals to understand.
You just mentioned kind of the tracing of the coronavirus from those that they've come in contact with. I understand that you increase your disease investigation staff to kind of help with that. And what does that look like? What are they doing once they understand that there's a COVID positive individual and some of the people that they come in contact with?
Yeah, it's a great question. So early on in this event, around March 10th, 9th, actually March 8th is when we had our first case. That first week, as you know, Johnson County had more cases than any other county in the state. And so we were fortunate that Iowa Department of Public Health has 6 epidemiologists that are around the state, and they have a number of counties that they assist with. And so we had 2 of the state's epidemiologists embedded physically in our building with our own disease prevention specialists. So there were 4 individuals that first week that were really making all of those calls and contact tracings. And then as other cases shown up in other counties, they obviously had to assist those counties that just don't have the same capacity perhaps that larger public health department would have. And so then we kind of redirected some of our own staff and have trained additional internal staff to help with our disease investigation. And so right now we've got 5 individuals that are doing that full time. We've got a couple that are specifically working on specific cohorts, for instance, the long-term care facilities. If there was any positives there, we're working very closely with the administrators in those facilities because we all realize that that's a very vulnerable population. We want to do absolutely everything that we can to keep the virus out of those facilities. But really, those calls, you know, that's what they're doing all day long and all weekend long as we get new cases. They simply don't stop on Friday and start again Monday because of the number of cases that we have coming in over the weekend. We would just get behind very quickly. And so they are working 7 days a week since this has started. And so we recognize the stress that puts on them as well and try to find additional staff internally to help out.
I can only imagine that that's a never-ending process to try to track all the individuals or even kind of a select group when you're thinking about exponential growth and even, you know, trying to contact the individuals, the names that they gave you that they were in close contact with. And I understand that you really can't go after every individual case that comes your way.
Yeah, that's a good point. Really, early on, we were trying to do that. To be honest, that's part of their role during these investigations. And remember that Iowa Department of Public Health has over 50 communicable diseases that we are required to do contact tracing and surveillance on. This is just one. But really, it's important to understand that early on, we were contacting and asking those questions of all of those contacts, not just family members. Now, when the widespread, the community spread was so wide throughout the county that Iowa Department of Public Health really phased that back to just close contacts and family members. And even just with that, it can be overwhelming, but certainly the philosophy there is once it's out in the community and widespread, it's really, we're not in the prevention mode anymore. We're really in the mitigation and what we can do to slow that spread down.
And I could appreciate not being able to reach out to everybody, but I would imagine if it's like a Tyson situation, you know, you have, you know, the individuals that are family members, and you can probably go a little bit beyond that, but at least within a facility, you can kind of trace it. So if someone is a part of a healthcare facility, then you can probably go to their department and that type stuff.
And that's a good point. I mean, in the businesses that are still operating, that still have to operate the essential services, whether that's healthcare or food production, it is much easier to work with those facilities to be able to either do mass testing, perhaps, or certainly to be able to share the importance of isolating, of assessing your signs and symptoms, those types of things to again try to reduce that widespread that the virus just, you know, it's very easy for this virus to spread. And that's the other thing with this being a novel virus. We're learning more and more. The scientists and the medical community is learning more and more every day about how quickly this spreads, how it spreads, how long the virus lives on different surfaces, what can protect us and what doesn't protect us so well as far as face masks and all of these things. And so, I'm sure down the road in a year or two, we'll know much more about this virus. At this point, I think those decisions are being made with the best available data that we have.
We're in a meeting every day at 3 p.m. Monday through Fridays, where you're a part of that meeting and you're helping us to understand just how ever-changing the rules are and the recommendations are for the coronavirus. Definitely it's a learning process, learning in the process. It is never ending. It seems like there's something new all the time coming up.
With this being novel virus, we don't know a lot about it. And early on, our messaging was really trying to emphasize the fact that we don't have all the answers, and the recommendations that we put out today may change tomorrow. And that's something that is hard to understand, I think, for the general public. But it was just a fact of this particular virus and any really novel virus. I know in 2008, when I was working with the flood situation, our messaging was literally changing by the hour as the predictions for the river were not completely accurate, or there was forecast of rain. One night we got 2 inches and the river rose 3 feet overnight. And so there's just a lot of unknowns. And I think that makes people uneasy as well, and frustrating, to be quite honest with you, which I totally understand. It's hard from our standpoint as well when we don't have all the answers, and when the guidance from the CDC and Iowa Department of Public Health changes. We have to, share that information and share those changes. And so as we're learning more, the messaging changes, and that will continue. I mean, we're not through this yet, and no doubt there will be new guidance and new directions that we'll get that we'll try to convey as well.
When I think about the floods, as you just alluded to, there was a playbook from 1993 in a way, when we had the floods then, and then in 2008. The 500-year flood or whatever happened. But this is so different. There's really no playbook that we've experienced here locally within anyone's lifetime.
No, there really is not. That's a good point that you bring up, Bruce, because there have been devastating floods over the last 100 years that we can kind of go back to. The floods are happening more and more frequently, unfortunately. And as the climate changes, as the world changes, we could expect to see more novel viruses as they mutate. They'll come out with a vaccine, they'll find, and they'll do the research, and they'll have a vaccine for this, just like we do for other viruses within this family. But it could easily mutate and change again. But you're right. I mean, this pandemic is unprecedented, as we've heard for weeks now. And there is no playbook for this. We are doing the best we can. I will tell you, though, that all of the preparation that we do for this type of event is the same, no matter what that event is. So whether it's a flood, a winter storm, influenza or pandemic like we're in right now, all of that preparation that we've done for years leading up to this has been very similar. So again, going back to working with the hospitals, working with EMA, working with all of the nonprofits in our community, going through those drills, we walk through what does it look like if we've had a tornado, but then all at once there's a train that derails that has hazardous chemicals on it. These are called injects when we have these drills. And so it gets everybody in the room involved, right? So whether we have to shelter in place or transport or close schools down. So we talk about those things. The hospitals have surge plans. So that if there's, Eastern Iowa Airport is just up the road, what happens if we have a major plane crash like Sioux City did decades ago? What does that look like? The hospitals have a wide service region involving multiple counties that do not have hospitals. And so their surge plans really take all of those variables into account to be able to respond to an event like this. Now, granted, this event is hard to think up of when you're doing a drill. I don't know if anybody would ever come up with this type of work, but I know CDC does. The CDC, when they do their planning and drilling, they have worst case scenarios. And so they've drilled and talked about influenza pandemics before.
you talk about like the greater effort that is happening within our community. What a lot of people out in the public don't know is that at 3 p.m. Monday through Friday, like I mentioned before, that there is the EOC, the Emergency Operations Center,
Correct.
happening, and we have all of Johnson County leadership, as well as we have police and fire from different communities, including Swisher and Tiffin, and all of us are there, and we're talking about this on a routine basis, so that we're all having the same knowledge at the same time and figuring this out together.
No, that's a great point, and I skipped over that when you made that comment earlier, and that's so true. We do not meet on the weekends, but Monday through Friday at 3 o'clock. There's over 100 people on that phone call, and we go around the room and really share out what is happening, what our needs are. The hospitals share their the PPE needs that they have, as well as long-term care facilities. You mentioned law enforcement and fire as well. All of the schools are represented on that call as well, sharing what they're doing with their students. We have transportation on that call. We have United Way, social services. So everybody, as you mentioned, is talking about what their needs are, and then we can either have a separate call afterwards with those individuals needing to be on that call to kind of work through that situation. That happens not every day, but nearly every day that an issue comes up, that we'll have follow-up calls after that 3 o'clock briefing.
It's a lot of planning going on, and I know that right now it seems like we're kind of in our peak, but who knows what we're in. The hospitals, there's a huge concern on how they'll be able to deal with the influx, because we realize that it's not only Johnson County residents that they'll be taken care of, especially at our state hospital, which is the University of Iowa Hospital and Clinic. So
Right.
what is the preparation happening for the hospitals to be able to deal with that influx?
Yeah, that's a great question. And certainly part of their surge plan is to prepare for a large number of people coming into their facilities. So they've done a number of things. They've reduced all non-essential procedures. They've converted certain rooms and beds to negative air pressure. They have secured additional ventilators. They're constantly asking for more PPE, and Dave Wilson and his crew at the emergency management is doing a fantastic job in sourcing and finding the PPE for healthcare providers. They're working with other hospitals, not just here in Johnson County, but hospitals across Eastern Iowa. They have communication chains open with them as well, so that if one hospital would happen to be at capacity, they could shift patients to another hospital. So they're doing all of these things really in preparation for a large number of individuals. At this point, they are handling that very well. They're not close to full capacity. But as you mentioned, we don't know if we're at the peak here yet or not.
I've been real impressed with the hospitals, which is the University of Iowa Hospital and Clinic, Mercy Hospital, and the VA Hospital, Veterans Administration. Very impressed at how they are coming together, collaborating, making sure that they're sharing information that'll be helpful to all of the entities. And again, the workers there, kudos to them for being frontline workers, continuing to work. That's something that we've been, saying amongst ourselves, but I wanted to just make sure that we took an opportunity to thank those workers at the hospitals that are really providing those critical care to not only COVID-19 individuals, but they have other operations and individuals that have critical needs as well.
Yeah, that's absolutely right. I mean, we cannot thank them enough for the work that they're doing. It is extremely stressful for them. I've got several friends and family members that are healthcare providers as well. And, this is what their passion is. They are in this field to serve individuals, to treat individuals. So this is what they signed up to do. However, this again for them is unprecedented. And, I think we've seen stories across the country and world where healthcare workers also become ill and unfortunately lose their fight to beat this virus. And so it is very serious for them. They are taking every precaution that they can to protect themselves. But you're absolutely right. The community really needs to understand the sacrifice that they're making. They're away from their families. Many of them are not even going home, staying in hotels just so that there's not even a chance that they either get the virus from a family member, or if they happen to have it, that they would share it with family members. And so I think, in Johnson County here, and really in Eastern Iowa, we are blessed with having 3 fantastic facilities just here in Johnson County, 2 up the road in Lynn County, Scott County. And so, we are in a very good spot as far as our healthcare providers and facilities that we have right here. But you're absolutely right. I mean, my hat's off to them as well.
Long-term care providers, you mentioned them earlier as well as being a part of, the conversation. So thanks to all those workers, we also have people in home and community-based services that are providing services to either hospice individuals, persons with disabilities, even just some chronic ill individuals within our community, and they're still sacrificing it and going into work. And so hats off to all of those. When we talk about long-term care and the stats that are coming out, now the governor or Department of Public Health at the state have new and additional matrix that they're kind of displaying, or demographics that they're displaying. And one of them is talking about the ages, and I was surprised to see that the ages of male and female were essentially equal. But when we look at elderly people, as well as individuals that are Black and Latino, can you tell us a little bit about what we're seeing? Because we know in other parts of the country, elderly are, their rate is high, as well as Black and Latinos are disproportionately high.
Yes, that's a good point, Mayor Teague, because it is something that we need to be aware of and do everything that we can to get the messaging out to those individuals. The long-term care facilities early on took some very aggressive steps to really restrict visitors, also to monitor their own staff and their own residents. So they've done a fantastic job here in Johnson County. I mean, they put some of these strategies and policies in place before we even had our first positive here. And then, of course, the daily phone calls that we have with them. But to your point, with Black and Latino communities as well, we are really trying to do everything we can from a public health department to be able to get that messaging out. So we've got all of our documents in multiple languages on our website. We're also working internally here at Johnson County with our cultural and diversity coordinator. She's been tremendous in helping us understand how to get this information out in the best effective way. Royce Ann Porter, one of our board of supervisors, has also been consulted and is helping us really identify specific ways that we can reach out to the communities that you spoke about, because it is critically important. What we'd love to do, and we've actually, at tomorrow's press conference, we'll have some community members as well, really representing different populations in the community. And hopefully all of those efforts that we're putting forth will help to really provide that information in the best available way.
Earlier on, you mentioned kind of the process if someone is COVID positive, or think they're COVID positive, reach out to your healthcare provider, and then from there. But I can tell you that what I want to know is, what is the status of the testing kits within our community, the availability of it, as well as what are some of the eligibility criteria? I've been hearing from residents that have reached out to their healthcare provider, actually either seen them in person or via, now we have this great thing called telehealth, which has been there, but now it seems like it's really prevalent that it's being used. But they'll go to their healthcare provider, and the healthcare provider will say to them, you are definitely COVID positive, but we won't test you. They're denied the test. So these are presumed positives. Can you talk a little bit about what is the criteria to even get the test and what is the availability?
Great questions, questions that a lot of people are asking. So let me take a couple of them here to start with. The availability of testing, from my understanding, is still limited here in Iowa. Now, I do know that you see on the news other states perhaps testing more widely than what Iowa is. Some of that has to do with the supplies going to those states with more cases. But certainly the criteria here for the state hygienic laboratory to test for free are very specific. And those guidelines, again, changed Friday. So there's really four main groups of individuals. And again, remember that the criteria is also just based on the healthcare provider's assessment of that individual. So if that individual calls them up, shares that they have these symptoms, but they don't meet one of these four areas, then it's up to the healthcare provider. But typically they are going to say that we are not going to test you. Not that they shouldn't be. We would love to, from a public health standpoint, be able to test many, many more people. So I don't want people to misunderstand that we're not wanting to test. We have to, we need to be able to fully understand this virus. And really, quite frankly, I think we need to do this to be able to get our communities back to where we were before. And I'm concerned that if we don't have more testing capabilities, that's going to somehow hamper our communities to get back to where we were and to where we want to be. But back to those four categories, really, and all four of these, the only way that they're going to test is if they show signs and symptoms of a fever or any type of respiratory symptoms. So the first one is the hospitalized patients. So anyone that's hospitalized that either has a fever or a respiratory illness qualifies for a test. Now, again, these are qualifications through the state hygienic laboratory that would be provided for free. The second category is any of those individuals that are over 60 years of age or have underlying health conditions, again, with fever and respiratory illness. The third one is any individual living in a congregate setting. So again, long-term care facilities, dormitories, residential facilities, those types of things, if, again, they have a fever or respiratory illness. And then the last one is those essential workers, the healthcare workers, first responders, those individuals that are working in those types of essential services, also if they had fever and respiratory. So those are the four categories. That is the guidance from Iowa Department of Public Health. Now, that does not mean that a healthcare provider couldn't say, yes, we feel like you should be tested, and you could go to they could pull that sample, send it to a private laboratory, but that is not free. That would cost the individual, and so that's kind of a little bit of the status right now that we have for our testing capabilities, and that's likely what you're hearing from people saying, I call my healthcare provider, they assured me that I probably have it, but they're not going to test me, which I understand is very frustrating. And I just want to reiterate that I do feel like we need to do more testing, and I think the governor feels that way, and everybody else feels the same way. But until those testing capabilities ramp up a little bit more, I don't know if that's going to happen. The important other thing to understand is really not that this, I don't want to diminish it at all, but about 80% of the people that do have this virus will have mild symptoms. And there's no medications that healthcare providers can give. There's no vaccination that we can administer to help prevent this. And so 80% of the people that do have it will have mild symptoms, be able to recover at home after a few days. Now, there are certainly individuals that are elderly or underlying health conditions that don't have a quick recovery of this as well.
Well, with what you just stated, I think the response that needs to be really, really clear to those that have gone and, the doctor has said, yes, we believe that you have COVID-19, is to really do the 14-day isolation. For them to understand that they won't have a definitive test to say, yes, you have it, but we need you to act as if you do have it. And isolate for 14 days. Definitely, if you have family members that are that you're in close contact with, or even close coworkers, I think that's another, missing piece. If you're still one of those essential workers going into the workspace, make sure that you are on some level sharing the importance of, that you're presumed positive, because I think that is where that community spread, as you say, how are we going to get this to stop? People have to know that they're positive. There's asymptomatic people that we know run around, and when we're looking at the presumed positives, so you're talking about asymptomatic people, individuals that have been denied testing, from the healthcare provider. So those are major concerns when we're talking about the presumed positives and those that are asymptomatic. And how are we going to get to zero? That is our goal, right? To get to 0 cases in our community.
Yeah. And, I don't know if that's going to be a reality to get to 0 cases for sure. But, you make good points, obviously. If you have any of those signs or symptoms, even if you have not called your healthcare provider and been told that you probably have it, if you have any of those signs or symptoms, don't go to work. Fortunately, telework now is very common across the community. Don't go out to get groceries. See if you've got a family member or a neighbor or somebody that can get that, or even the delivery services now that are being offered that can bring the food right to your door. It is critically important that we really understand those mitigation strategies to, stay isolated for 14 days if you have those. Even if you don't have symptoms, as you mentioned, there's asymptomatic individuals that are carriers of the virus and could spread that without them even knowing it. And so, the cloth face masks now that many people are wearing will help as a source control. Staying six feet away. I was out many times this weekend on the trails, and people are really adhering to that. I don't know as if there's anybody in the community or across the state that has not heard this message. And I think it's just the responsibility of each one of us individually, our own personal responsibility to really do what we can, not to think that this is, I don't have it, I'm not going to give it to anybody else. No, just understand that you likely may have it, and yes, you can give it to other people, and you need to take responsibility to protect our elderly and those individuals with underlying health conditions and our more vulnerable populations. And so I don't want to sound angry about this, but I do want people to understand that each one of us, and that's where, earlier on we were talking about how this is different than other influenzas during the winter, is that this literally affects every single person in Johnson County. Yes, it really does. There is not a single person that does not have a role to play in this pandemic. And I think a lot of people don't understand that or don't want to believe that, but it is true. And that message will not change. We talked about messages changing from day to day or week to week. That message will not change. We all have our responsibility to take action, to do what we can to protect our family members, our loved ones, and other community members that we work with or that we are living with at home too. So no, those are good points. I'm glad you brought those up because it's really important for us to take this very seriously. We hear all the time about flattening the curve, and really the purpose of that is really to not overwhelm our healthcare system. I mean, if we had unlimited healthcare resources, it might be better as a society just for everybody to get this and get it over with so that we can get back to normal. But we don't have that capacity. There's no way that we could prepare and plan for that type of a surge. Other countries have tried that. And, it's like years ago, with chickenpox, my parents would send me to the neighbor's house that did have chickenpox just to expose me, just so I would get the the virus and to be able to develop an immune system to that. I'm not saying this is the same, but it's something that we're waiting for that vaccine. And again, just like every year we get our flu vaccination, that's for certain strains, and that's always a guess. That scientists try to predict what strain will be prevalent in the communities, and then they develop that months and months in advance. And I think the efficacy rate of the flu vaccine is somewhere around 50%. So it's there's not going to be a silver bullet here to cure this or to prevent this moving forward.
Yeah, that's the thing that we certainly don't know what it'll look like in the future. But you talked about definitely individuals, doing what they can, because we're in this together, for one, and we all have a role to play. I've been so impressed with our community members that are making masks for their neighbors. I was at my house and I went outside to go get the mail, and here I see a bag of homemade masks, 2 of them, for me and my partner that live in the house, and a neighbor, made them for us, and that was really nice. But there's people out there that that shouldn't go to the grocery store because they're either a presumed positive or they're positive, and we see community crisis in food bank services have delivery options now. We also see some students, University of Iowa students, that are doing pickup deliveries, and there's some shopping carts. I don't know what else is out there, but there are ways for people to safely get materials and critical food in their home without going into the public if they're positive or been presumed positive by a doctor. So I've been impressed with our community.
Yeah, I would have to agree, Bruce. I mean, not only the sacrifice that they're making, for their neighbors, but also just the ingenuity, the creativeness of this community is impressive. They are stepping up and helping other individuals, donating their time, donating their resources. And, as you said so many times before, we are in this together, and we all have a part to play, not only in the prevention, but also to help our neighbors and family members and those in the community that we may not know personally. But there's so many different ways to help. And if anybody is looking for ways, I know the United Way, their volunteer services in Patty Fields is really doing a lot of that coordination as well. But there's just so many different organizations. The hospitals have ways that individuals can volunteer to make PPE as well. So you're absolutely right. It's really reassuring, and it's such a positive aspect of this community.
I know people in our community they're getting a little weary because we've been in this, kind of stay at home and wear your mask. And I even wear gloves when I go to the grocery store, just to take those extra precautions. But I think it really does need to be done at this time, that we think we're going to be here for a while. And so everyone out there, please continue to do what you can so that we can keep our numbers lower. It is true that the numbers that are out there are not accurate. I mean, that's a fact. And so I think we just have to continue to make sure that we're doing all that we can to keep ourselves safe. And in return, we're keeping others safe by wearing a mask. And so that's a message that I'm sure that you would echo as well.
Yeah, absolutely. And you're right. The numbers are not accurate. We simply don't know how many people out there are positive. Maybe they've had it and they've already recovered from it, which again just reiterates the fact that we need to do everything we can. Just assuming that it's out there amongst us when we go to the grocery store or other things, which is not comforting. I understand that, and we do need those numbers. We do need that accuracy, and my hope is that here fairly soon we can have the necessary supplies to increase our testing across the state.
So we know that knowledge is power, right? The more people have information about the COVID-19 virus, the better it is. I understand at the University of Iowa, they have interpreters that will give information in the individual's preferred language. What are some of those resources when we're talking about ensuring that everybody that we can possibly give resources and information to in their preferred languages? What are some of those resources and where can they go for that?
Yeah, that's a great question. So there's a number of different places I think that people could probably go to. CDC does have some of the resources in several languages. Iowa Department of Public Health as well. We've utilized all of those resources as well on our website. If you go to the main page of Johnson County Public Health, there's a link there to our COVID-19 webpage where we've got every press release and all the documents, many of which are in several different languages. And so those are a couple of resources. 211 that United Way manages is also another resource that individuals can call to. But those are the main ways that people can certainly get information. And if that's not the preferred way, certainly give us a call if there's other ways or other things that Johnson County Public Health can do. We'd entertain that and like to know how we can get that information out.
Yeah, I think it's important that we all get information that we can understand so that we can do our part. That's what we're talking about. Everybody has a role to play, and we can do our part to make sure that we can get past this. And so thank you for doing your part. You have been at the helm of this so much that we really appreciate all that you're doing and the guidance that you're giving our community to keep us safe. So Dave, I want to say thank you so much for all that you're doing.
Well, thank you, Mayor, for your leadership as well and for those kind words. There's a lot of people here at Public Health. As you can imagine, it's not just one person, but I will share that sentiment and those kind words with the other staff here, and we really appreciate that as well.
Thank you for joining me today. Appreciate it.
Thank you, Mayor.
That's our show for today, but you can find additional resources from health experts on our website, icgov.org/coronavirus. We also post information on city closures and response efforts on that page as well. We'll be back on Thursday with another Community Connection. I'll be speaking with Johnson County Auditor to discuss how to safely vote in the upcoming primary election. Until then, stay in place, maintain your space, cover your face, be safe, Iowa City.